Welcome back to Wayne TV. I'm Joel Gilly. I have my very special friends from the United Way. We've got Sherry and Rachel here. Guys, it's been a fun 2020. And first of all,
Yes.
we've got to kick off with the campaign, right?
Yes, absolutely. Thanks for having us to talk about several things, but really we wanted to share and say thank you to this community of Wayne County for supporting the United Way in their annual community campaign. We had a goal of $900,000, which would impact the lives of 18,000 people, and so we landed after 2020 at 94.3% of that goal.
On top of a pandemic going on, with all this, still at 94%.
Yeah. We are so happy about that. Probably most of the time, 100% is our goal.
Absolutely,
but
absolutely.
I'll tell you, with everything that, all the challenges and, everything that we had to do differently, and that this community allowed us to do differently, we were so happy to get to 94%. My colleagues across Eastern North Carolina, I was talking to one last week who said, how did you get this close to your goal? Because most of them are sitting at 75 to 80%.
You said, guys, there's something special in Wayne County.
Well, I did.
Sorry.
I just said when you've got this, and they have caring communities too.
Yeah.
But we have a very caring and supportive community. Between government, businesses, schools, all of them coming together, and then you have an amazing campaign chair. Bethany Perry was on top of it, so enthusiastic.
Yeah.
She was determined, and so she did a fantastic job once again. And so, yes, 94.3%, we were very happy with.
That's awesome. And you think about it, you were talking about 18,000 lives, and to some people that may not seem like a lot, but you got to think about it, we're a county of 125,000-ish.
Yeah, exactly.
18,000 is a good chunk of those that you can affect. So that's really cool.
So that's through, the support that we know that we can do through the programs that the community campaign supports, but also because of the support that we receive, it helps our office to be able to do things like prepare for natural disasters like the crisis that we've dealt with for the last year of COVID. To be able to go in and just quickly be able to pull together the support that was needed for the public schools, for the hospital, to bring those resources together, we couldn't have done that without the community support.
It's funny, it always seems like when we're working with emergency management or something, when we have a need that needs to be filled, we're always like, who can we call it? The United Way is always typically at the top of that list, but it always gets done, and it always gets done so perfectly. And so, it's more than just helping out those partners, it's helping the community, and like you said, having those partnerships is just it's been great for us as a county.
Phenomenal.
So.
We've been so grateful, but something else that has really given me a comfort level too is this community stepped up very quickly to be able to give to natural disaster of COVID. So in addition to the funds that we raised that will help support programs for this year, we distributed over $300,000 for COVID relief, so to multiple nonprofits, so many different programs.
Yeah.
So that was such a privilege to be able to do that too, and help, Partnership for Children to be able to support some of the daycares that were remaining open for those essential workers.
Yep.
But they needed, more cleaning supplies, or they needed to be able to have partitions to be able to keep everyone safe. From there to if you had individuals, we've dealt a lot with folks who needed to be isolated. Maybe they were kind of couch surfing, they didn't have a home. But when you're doing that, if someone is being isolated, you've got to get out.
Yeah.
Where are you going to go? So those funds helped us to be able to make sure they had a roof over their head and they could be quarantined. We talk a lot about you've got to quarantine during this time. What do you do if your home is not your own?
Absolutely. And what do you do when you have food insecurities during that time? It touches so many lives especially during this pandemic too. And the other thing that always sits well with me, and I know that it's very well respected, is the United Way is keeping an eye on all these organizations that money's going to and making sure that their financials are good and that the money is going back into the community, which is always important.
Well, we're able to do that through the Community Impact Committee. They are on top of it. Rachel oversees that committee. Rachel is our Community Impact and Engagement Director, and so that committee looks at all of those nonprofits that are applying for funding. We vet those nonprofits, and so we go and do tours there, and we pop in occasionally to make sure that the programs are working as they should. So it's just a privilege to be able to do that, and it creates such a great partnership.
It does, and it's a good check and balance. People want to know that their money's being. I always bring that up just to hopefully put people at ease, that are worried, because a lot of times they send the money off and they're not sure where it's going, and, so that's always a good thing, I feel like.
Absolutely.
Also, one of the big things that you guys have been working on is a partnership with the health department, but also Cure America has come in with a lot of resources, and that's been re-upped, right?
It has. I mean, it started out last July. We were able to apply for a partnership with the health department to support their needs. And as you can imagine, as our community can imagine, they have been overwhelmed with work, trying to really run with the needs of COVID while they're still trying to make sure and serve the community with the other health needs that are out there. And so our partnership just started with us trying to help with resources and with being able to provide referrals to individuals who were COVID positive. And so we started out a little bit, but just within a few weeks, Cure Americas is a global organization, and they had a partnership with the state, with the Department of Health and Human Services. They had 150 community health care workers, and they had 2 of them assigned for Wayne County.
Awesome.
So since we already had that relationship with the health department, they were willing to let us tag on to that. And it quickly, once things started escalating, as everyone knows, our cases began escalating. Then they allowed us to have 3 and then 3.5. So now through our Cure Americas grant, it actually ended December the 30th and started again in January. But that grant has allowed us to have 3.5 community health care workers so that we can contact majority. It was all of them, but it's gotten to be so many we can't do all. But majority of the positive cases we call and we do some work there. I'll let Rachel speak on that. She's doing an amazing job overseeing that process, and it's kind of funny. We initially thought, well, we can do this and do all of the rest of our job, and this is probably going to take a good 10 to 20% of our our day. It's probably taken about 70% of the day.
And I'm glad y'all said that, because it's the same way, with a lot. You mentioned the health department, same way.
Yeah.
These people, I always try to give them props wherever I can, because I feel like health departments are often underlooked, or overlooked, I should say.
Yeah.
A lot of credit goes to nurses and doctors, and they deserve it. But you got these health department staff that are on the on the ground floor, front line, doing a lot of that contact tracing. And like you said, like 75% of their day now is consumed with COVID. So
it is. But
talk
Rachel,
a little bit about that, though.
Yeah, so we work very closely with the health department. Everything we do is HIPAA compliant. Our community health workers receive cases from the health department in terms of people who've tested positive recently. They call them, screen them for their symptoms, and kind of do the pre-checking interview for the health department. Who have you been with? Where do you go to church? When was the last time you were there? And then also find out, because of COVID, are you facing any struggles? Do you need groceries? Do you need help with your utility bill? And then try to match them with an organization in our community that provides that assistance.
I think that's so cool, because, and you guys might know better, how many United Ways are partnered up with health departments?
For this kind of project, we don't know of any.
One. But it makes so much sense.
It does. Well, what else has been so surprising to me is, so again, 150 of them across the state. So I think there were 20 or 21 of these different units across the state that are handling either one county or multiple counties. We are one of, I think it's 3 of those that are working this closely with their health departments. The rest of them, we've been saying, what do you do if you don't? I mean, how are you helping people? Because all of this information, not just if you're testing at the health department, but everywhere you're testing has to go back to the health department.
Every positive case
Every positive case has to be input and has to go in the state information. Now, we don't have access to that, so we're doing all the data and making sure that it stays HIPAA compliant with us, and then we've got to get everything back to them because they have to put all that data in. So if you can imagine, every day with the number of cases that have been fluctuating and mostly, unfortunately, in the upward range, they've had a lot of work to do. And so our Cure Americas has, at first, we thought, well, things are going and we've got a great pace and things are going well. But Cure Americas was just overwhelmed by the work we were doing because it was like 8 times what everybody else was doing because of that relationship.
And you try to remove as many of those touch points, if you will, or barriers to entry, if you will, in that now, as soon as they get a call, you're then referring them off to get help. instead of them having to go seek it or you having to follow up after the fact, it's one call, and and so it's so efficient, which I love that, and such a great business model. I feel
Well,
like.
you know, and there were obviously, our community had challenges that we were trying to work through before COVID, and now it's just completely exposed so much more, and
Yeah.
so it's rare that we're not referring one of those positive cases to someone for assistance,
Yep.
for some kind of assistance.
That's right.
That's awesome, and I'm really hats off to you guys, because I mean that partnership has been incredible, and I know it's taken a lot of work off the health department because they need as much help as possible. Is there anything else we need to talk about, y'all?
Well, I would just say that, you know, if you're listening and if you know someone who tests positive, you may hear from us. We'll be calling, and obviously we're doing that on behalf of the health department. The health department now is really, they've got to really refocus and get their focus
Yeah.
on vaccinations.
Vaccine time.
So we're going to be continuing, because this doesn't stop either. The testing
No.
has to continue. You know, obviously we're hopeful that the testing and the positive cases will lower, but that's
Yeah.
going to take some time. So they're doing an amazing job, but there is definitely a lot of work to be done.
Wear your mask, socially distance, wash your hands.
That's right.
That's all got to keep going, and hopefully together we'll finish getting through this. We've done all right so far, but you know, I feel like a lot of people see that vaccine's on the forefront, and they're kind of giving up. But you know, just a little bit longer.
Yeah, we got to hang in there.
That's right.
Just a little bit more. Well, y'all, thank you so much for coming by. Again, if you have questions about any of the programs the United Way has to offer, you can check them out on the web. They're on Facebook. And you can also reach out, give them a call, or send them a message. They're always willing to help. We appreciate y'all for coming in.
Thank
and
you.
we'll see
Thank
you again
you.
next month. All right?
Thank you so much.